My move before it's too late. The enemy's at the gate. Must attack or seal my fate. Want my head, but they'll have to wait. They say it's not the sound of the dog in the fight. It's the sound of the fighting the dog.
Hello, my name is Michelle, and welcome to Impromptu Thoughts for West Coast Mesh Fighter.
California dreaming, I'm set to win tonight.
Hello, my name is Michelle, and I'm 43 years old, and I'm completely disabled because of a transvaginal mesh implant. One decision, promoted as a rejuvenation, turned out to be my worst nightmare.
In 2008, the FDA issued a public health notification regarding the serious complications that may arise from transvaginal mesh surgery. This surgery is performed to remediate pelvic organ prolapse. Back then, complications were noted as rare. However, in July of this year, the FDA updated warning stating that serious complications associated with transvaginal surgical mesh were no longer rare. From January 2008 to December 2010, the FDA has received almost 3,000 additional reports of complications. If you are considering transvaginal mesh surgery, we encourage you to speak with your medical provider about the associated risks of this surgery.
Okay, so when you go to see your doctor, your primary doctor, here in California, the rules are a little bit different. When you go see your doctor, that's when you let them know what's going on with you. And I can tell you that dealing with this for 10 years, I've learned a lot about the California healthcare system, and there are a lot of things that really need to be changed regarding how mesh impacted patients are treated when we go to the doctor. So I was with the county from the time I had to leave my employer. So I'll go from there, because that part of it is the most traumatic that I've had to suffer. Before, I had private insurance, and when I would go to Kaiser, if I was in pain, it didn't matter. I would get a shot, or they would give me more opioid medication to help combat the pain. It wasn't until I got to my county doctor and county insurance that the problems started to come about. When I first started going to the county doctor, it was extremely confusing on how I was going to be able to manage my health care. When I went to the county doctor, if I had a problem and the doctor couldn't see me, I would end up at the emergency room. And here in my county, in the city that I live in, there are 3 hospitals that I could go to. And I can tell you only 1 out of these 3 hospitals actually know what they're doing. There was a time that I was under the assumption, if I had kept everything with the county, going to the county hospital, going to the county doctors, that it would be a lot easier to track my prognosis, my diagnoses, and how well I'm responding to it. And the doctor, the gynecologist that I was seeing at the time, was continuing to prescribe my medication for me. because my primary doctor wouldn't do it. And the doctor that I originally had gotten at county seemed to be understanding and empathetic to my circumstances and wanting to help. But then we run into a problem with the insurance and the blame game, as I call it. So, mesh blame, it's absolutely traumatic when you've got things going on and you're not getting any answers, and they just shuffle you around like you're a nobody. And that's exactly what they did to me. And then the opioid crisis came about, and my gynecologist stopped prescribing my pain medication. And they hyped up this program that they wanted me to enter and go in and try the nerve block procedures, which, if anybody has been through that, is extremely painful. And they put needles into your back to try and do a nerve block. And after the fourth procedure, I just couldn't do it. It was so painful. I could feel it. Even with fentanyl in the IV, I could feel the shots going into my back, and I was crying on the table. And I'm not a doctor, of course, but I'm a patient, and I know what my body can and can't handle. And I know when I'm in extreme pain. And that was horrible. Scary too, because if I could feel that, what the hell is going on? But I want to go back to when the county stopped prescribing my pain medication. They did that. They found a loophole. If you're getting the back injection procedure, they will not prescribe pain medication while you're trying this out. So that was their legal loophole, so to speak, to stop prescribing a real pain patient with pain medication. They called this pain management, but it wasn't pain management at all. I suffered that whole time, and after the fourth procedure, I finally said, no, I'm not going to do this. And I went and changed everything. It took about 6 months to get everything switched over and myself out of county. I just was done at that point with them.